So, in this video, I'm going to discuss, or should I say, debate, about the question of should Maluku government implement travel restrictions on people coming in from other regions in Indonesia to cope with the spread of pandemic COVID-19. Well, as we know, our country and the whole world is being struck by this virus that has become a pandemic. And this question is one of among other many questions of how can we stop this pandemic going on. Okay, so before I move on to my arguments about this question, I would like to give a meaning to this question. So the two phrases that I think is the most important and what I highlighted from this question is travel restriction. And I'm going to tell you what is the meaning of travel restriction. So, travel restriction is an official law that is ruled by a government from a specific area or a specific region to limit people from coming in and getting out from that specific region. So, if you align that with the question, it means that people cannot come to Maluku because of this travel restriction, and people in Maluku cannot get out from the city, able to prevent the pandemic to spread even more. And before I continue again, I would like to lay out a few examples of travel restriction that is already being implemented in some countries around the world to also cope the spread of pandemic COVID-19. Okay, so actually more than 130 countries in the world have already implemented some form of travel restriction, such as screening, quarantine, that we are doing right now, banning travel from high-risk areas such as the US, Italy, China. And according to Pew Research Center, actually at least 90% of the world's population lives in a country that has already implemented some type of travel restriction in their country. So that is at least 7.1 billion people in the world right now that has already going through the implementation of the travel restriction. And that is from their latest research in April 2020. Okay, so I'm going to lay out the few examples of travel restrictions that I found. So, based on cathaypacific.com, I took from Australia. Australia bans all foreign nationals passengers to enter their continent, like the whole entire continent. So, if you are not an Australian citizen, you cannot enter Australia. Even when your plane only transit in Australia for a few hours and you can hop onto another plane to go someplace else, you can't do that. You cannot enter Australia if you're not a citizen. But that is contrasted and different from the travel restriction that is already being implemented in Cambodia. In Cambodia, they ban foreign passengers from coming only specifically from the areas that are high risk of the pandemic, like France, Germany, Italy, Spain, US, and Iran. So other passengers from other countries can come to Cambodia, but they have to bring medical certificate and medical insurance to reassure that they can cope with the pandemic while they're on Cambodia. Okay, I'm going to give you a few states of COVID-19 right now. First, worldwide, there are 1,804,510 active cases right now, based on theguardian.com. And then the state in Indonesia is that there are 8,211 cases that adds 436 just yesterday. And I took that information from kompas.com. And we move on to the state in Maluku right now. There are 14 positive cases. There are 193 people who doesn't have any symptoms at all. People under surveillance, there are 239 of them. And patients under surveillance, there are 10 people. I took that from compass.com, and all of those people were tested based on the rapid test that has been going on in Indonesia for quite a while now. So what is the status quo for this question? I think it's very urgent because, as we know, and I will get on to that later, this is very serious. And I think that the status quo for this question, especially travel restriction, is really urgent. So moving on to my arguments. So why travel restrictions? I have two arguments here. The first one, it can help stop or at least slow down the spread of the virus. Based on WHO, COVID-19, as we know, is very easy to be infected from one person to the other. The virus can stay in the surfaces for a long time, and what the infected person touches and the surfaces that infected person touches, from letting out a small droplets from their mouth or their nose, like for example when they're sneezing or they're coughing, and the small droplets that came out stick on the surface, and other people can touch that surface and get that too, get COVID-19. So it is very easy to get COVID-19. But most of the time the infected person doesn't even know that they have COVID-19 because the earlier symptom is so common and so similar to like a common flu. According to NewYorkTimes.com, scientists that are tracking the spread of COVID-19 reported on Monday in March 2020 that for every confirmed case, there are most likely another 5 to 10 people in the community with undetected infections. How scary is that? So people can come and go from the infected region to Maluku while bringing the virus without them knowing it. Because as we know, people who have high immune system mostly doesn't even have the symptoms of COVID-19, and they can infect other people that has lower immune system because they don't know that they have the virus. So they just go and roaming around and interact with other people. So that's how easy you can get COVID-19. From every positive patient that we see worldwide, they catch COVID-19 mostly by traveling to other countries that has already get the virus itself, and more exclusively in Maluku. After being infected, they went home and interact with other people and in result giving another person the virus again. And then the circle just continues. For example, in Maluku, patient number 1 came from Jakarta, as we know, came from Bekasi actually. Patient number 2 came home from Makassar visiting her grandkids and then catch the virus there, came home and then I think infected like one more person that is like under surveillance right now. And then the latest cases, the 13th and 14th patient also got the virus by coming home from Jakarta, and the other one coming from Bandung. So by limiting or restricting travel, it would minimizes the chances of people being exposed to the virus itself. Because stopping people from getting out to other region can save their lives without them even knowing it. Stopping them from walking into a war zone. And by stopping other people from other regions in Indonesia, because as we know, there are so many red zones right now in Indonesia, we can help save our community, because if those people that came from other regions come to Maluku and they don't know that they have COVID-19, they can easily spread it to us because they think they don't have it. And that is concerning, absolutely concerning. So that is why, one of the reasons why travel restrictions should be implemented right now. But don't wait, act now. By recent dates, I took this from JapanTimes.com, US peaked by the number of cases with 2,148 deaths per day. in a day, based on 10 April 2020. I took that from usatoday.com. As the country with the most COVID-19 cases. Because as we know, the first one before was like Wuhan, and then Italy came first, and then now US has peaked rapidly with amazing numbers as the first one. So why is that? From what I've researched from japantimes.com, one of the many reasons is that there is no national response. One of the most important things from the national response is that there is no government coordination for travel restriction. Because there are no travel restriction, people come and go out of the country for vacations and do unnecessary travel, and therefore expose themselves to the virus in another country and bringing back that virus to their homes in the US. Based on science.mag.com, because of that late response to the pandemic, because, US pulled out travel restriction actually after several deaths has already been occurred. And then after that, actually the US implemented travel restriction, which is too late. The US is falling behind on how to treat the pandemic. Jeremy Koenig, a senior policy at the Center for the Global Development, said that this is a virus that punishes delay. We're chasing the virus, basically. Also, I do note that travel restriction has been applied to Indonesia, because recently commercial flights has already been banned national and internationally. But given to think that there are already 8,000 cases right now, don't you think it's a little bit too late? So, because of the number that is still really, really small in Maluku, I think it is very important that we should act right now when our number is still low and our community is mostly still healthy. We should do that now, right now, before it's too late, like in Jakarta. And I want to give you an example of successful travel restriction cases. Based from theguardian.com, Federated States of Micronesia declared travel restriction on March 14. Vanuatu, a South Pacific nation, closed all of its border last March. And you know what? And both of them are two of the few remaining countries that is free from COVID-19. Absolutely free. The second argument that I have is that it can control the virus to not spread wider in the community by gaining control. So we have the control over the virus. How is that? So, as we know, COVID-19 starts in Wuhan, China. I took this from NewYorkTimes.com in late December. Before, the government instituted a travel ban and aggressive testing policy during that time from December to January. About 6 in 7 cases were undetected. But after the Chinese government applied the travel ban policy, they were able to identify the patients and treat them properly. So, by applying travel restrictions in Maluku, the government will know exactly the amount of people in Maluku. What I mean is that identifying them will be more easier. We can group them, we can make a data about who has travel records to where, and by that we can research, we can do it more effectively than letting the borders open, which people can come and people can go, and we don't know the exact numbers, how many test packs that we have to provide for everyone to have the test, We can prepare the medical supply that they need to be tested. By being organized like this, it will definitely minimizes the exposure of the virus, because the government is one step ahead at controlling the virus. So, the final conclusion is that travel restriction on people coming in from other region in Indonesia to Maluku is crucial, given in the fact as the number of cases in Indonesia is rising rapidly. 400 cases in a day. That is crazy. We as a Malucan, we can stop this to spread even more. Also, the government can control the virus by knowing and identifying for sure the number of people and where has they been, their travel records, and then selected those people, gather them, and do independent quarantine to stop them from interacting from other people. And by that, we can stop the virus from spreading. While the numbers of cases that we have is still low, we might as well do it right now. We have to act now to outrun the virus before it outruns us. So guys, I think that's all. Stay home, stay healthy, and also don't forget to wash your hands. Thank you.